And basically, a lot of patients with fibromyalgia, they also have the problem compounded by having disc problems, herniated, bulging discs in the neck, degenerative disc disease, and things like that. And what spinal decompression does is it helps heal the discs in the lower back or in the neck by creating a slow stretch. And one of the things we do is we put patients on the oxygen at the same time, so we're getting fuel and activation as we're stretching some of the discs and some of the joints in the spine. That does another great thing of providing a slow stretch, which sends messages up to the brain and increases frequency of firing of that cerebellum that we talked about. Remember, the cerebellum, when that's firing good, the brain's going to fire good, and the lower brain stem is going to fire good, and then the upper brain stem is going to slow down. So we also do spinal exercises. So every patient with fibromyalgia is a little different. And you can see that we use some of the latest, most revolutionary treatments out there for fibromyalgia. Now, let's go back to fuel and activation for a minute. Fuel, again, comes from oxygen. That's why we put patients on oxygen therapy. But fuel also comes from glucose. And glucose comes from how well your metabolism is functioning. So to be successful in treating patients with fibromyalgia, we also want to treat them not only neurologically, but we also want to treat them metabolically. So you have to look at a patient's thyroid. You have to look at their adrenal function. You have to look at their blood sugars, because if their blood sugars are out, they may have reactive hypoglycemia, they may have insulin resistance. That can really inhibit healing. So many patients with fibromyalgia, because they're under so much stress because of the way they feel, or if they had some of the emotional stress that brought fibromyalgia on, their adrenal glands are really shocked. And the adrenal glands, when they're shocked, they may create too much cortisol, too little cortisol if they become so fatigued. So we have patients that have adrenal problems. So we want to address their adrenals, we want to address their thyroid. Some patients have hypothyroidism, some patients have hyperthyroidism, and we want to address that nutritionally. We even have patients that have fibromyalgia, but they're also dealing with Hashimoto's disease, which basically means they have an underlying autoimmune problem. And that autoimmune problem is actually causing a lot of the fibromyalgia pain. So we want to address that. So what we'll have you do when you come into our office is we have you fill out this metabolic assessment form. And this metabolic assessment form has multiple categories for different systems in your body. It's got a category for your glucose system. It's got a category for your digestive tract, for your thyroid, for your adrenals. And we can figure out exactly what type of symptoms you're having. But even more importantly than the metabolic assessment form is looking at your blood work. So we want to run a complete blood count with autodifferential. We want to do a metabolic panel, which includes looking at your glucose. We want to do a thyroid panel. We want to do a lipid panel. We also want to do what's called an adrenal stress index. And basically what an adrenal stress index does is it looks at your cortisol levels. Do you have too much cortisol? Is that affecting your brain function? Is that affecting the way your body functions as a whole? It's also going to look at your progesterone. We're also going to look at your secretory IgA, which has a lot to do with the irritable bowel syndrome. So it's very important that we look at the adrenal stress index. What we do after we get your blood work information is we put that information into a computer. And what that computer will do is it will print us out a specific graph of exactly where you should be to be as healthy as you can for you to heal. The greens are normal. The yellows are where a patient would be out of the optimal or functional range. And the reds are where you would be in the laboratory range or outside of the laboratory range. Now, we look at your blood work from a preventative medicine model. And basically what that means is when you look at the different ranges, so let's say you go to your medical doctor, he's looking at mainly the laboratory or the disease range. And that average comes from everybody getting blood work, including people with, AIDS and cancer and the very sick and the healthy people. And so that's the average. A preventative medicine perspective looks at your blood work from a functional or optimal health model. And the way that works is basically it's looking at the average of only healthy people, people with no symptoms, people with no pain, people with no disease process. And so what we want to do with our fibromyalgia patients, or any patient with chronic problems for that matter, is we want to get them in the optimal range so they can heal. And so what we'll do is put you on a specific nutritional program, and the nutritional supplements, most of them come from Apex Energetics. And Apex Energetics is the nutrition supplements that we do recommend. One other brain-based program that I wanted to go over with you that is really good for patients with chronic pain, especially patients that have chronic pain and balance disorders or vertigo, is we use what's called an interactive metronome. And I forgot to go over this with you, but I do want to go over this. The interactive metronome is a brain-based program, and basically what happens is the patients will put on these headphones, and what will happen is they're going to hear a tone, and at the same time they need to tap. They're going to tap every time they hear the tone, and they need to hit exactly when the tone hits, down to the millisecond. So what that's doing is it's developing parts of the brain that develop rhythm, timing, and this is what we see in patients with fibromyalgia. They lose some of the rhythm and timing in their brain. So this is a very important neurological treatment that we do. We also add that. So that's basically it. So when you come into our office, we're going to check you neurologically, we're going to check you metabolically, we're going to develop a specific protocol to get your body to heal. So if you're serious about fibromyalgia and you're serious about getting well, what I recommend you do is you call our office and you set up a fibromyalgia discovery visit. And basically what's going to happen there is you're going to be able to come in and you're going to be able to sit down and have a full consultation with us. We'll be able to sit down and do the neurological testing that we need to do to find out why you have the problem. And at that point, we'll let you know if we can help you. And you're going to see our number flash across the screen. It's 610-518-3370. You can call that number and tell one of our front desk assistants that you want to set up a discovery visit and that you have fibromyalgia, and we'll be able to help you. Okay? Also, at the end of this DVD, you're going to hear about 3 to 10, I'm not sure how many we're going to put on there, but we're going to put a lot of fibromyalgia testimonials of patients we've helped. It's going to be on this DVD. If you're watching this on the website, Ask Dr. Childs, Dr. Durr, you can page down and you can see where you can listen to a tremendous amount of video testimonials and written testimonials of patients we've helped with this problem. So thanks a lot. Take care.